Hi, Nick here. We're at the amazing MedTech World 2025. Ali Tinazli, he's here with me from Lifespin Health. In your opinion, big data is going to totally revolutionize healthcare, and you're about proactive healthcare, right?
Yes. So you speak about big data. Thanks, first of all, for having me here. It's great to meet again after 1 year. Now, big data is a buzzword, right? It's around for more than 10 years. The question is more like how to get useful data. And on the other hand, being proactive in healthcare, what does that mean? Does it mean I go to my physician once a quarter to get my checkup done instead of annual once a quarter? Kind of, but to be honest, our perspective is different because when we say that health systems need a new way how to look at prevention is not only about repeating of what is standard of care. And the reason is following. In standard of care, we think the data are not integrated well enough to make a comprehensive statement about the health condition of a given individual. I don't say patient because can be healthy person, right? Now, just to explain this, what I mean by that, when you perform your annual checkup, you get a list of, let's say, 30 parameters. I don't question the data quality. All great curated data, well-established systems. The issue is the parameters are being mostly looked as a standalone. That means as long as you are within a reference range, most healthcare providers will say, oh, it looks all great, come back next year. What is being missed out, and I got this confirmation actually from physicians, so it's not a technologist IDW, it's something I've heard actually from physicians. What they see as a shortcoming in the legacy testing is when you have chronic diseases emerging, diabetes as one of the most common chronic disease, you don't see those shifts happening until it's too late. That means either it flips or it does not flip, but you don't know until it doesn't flip what the actual disease risk is. And the reason is the parameters are not being assessed in a group on a group level. What we are doing at Lifespin, we collect a blood sample, we digitize the blood sample. Now what's important to understand is we captured 250 metabolomic biomarkers quantitatively. So we have the concentration. So far, so good. You could also say, I do more in a normal lab and it's fine. Now the difference is we put those biomarkers into context. That means we project entire metabolic pathways, and because we combine those data, we can tell if there are subtle changes on the way which are ongoing, which are indicative of an early onset of a disease. That means the parameters or the values are still within a reference range, but they change their range among each other. That means I have biochemical changes in the body which will result, if I don't do anything, which will result or may result in 5 to 10 years in an actual chronic disease like diabetes, like liver disease or atherosclerosis.
And the data, the biomarkers that you have, they allow you to look at the human, I guess, the genetic level, but also the environment or what changes, I guess, to be able to judge and see what's going to happen and be able to prevent, right?
So the biomarker we are looking at actually are on the level of the metabolism. So basically our everyday metabolism, right? Now, of course, the genomic blueprint is the foundation, but the genomic blueprint does not tell you if you have a certain severity of a disease outbreak, right? So basically, it's still limited in the statement. But the metabolism is the execution layer of biology. That means whatever is happening, it becomes evident on the level of the metabolism. And that's why we are so keen to focus on the metabolism only. It gives you enough information. Another reason why we do that is if we perform a test using our software looking at the metabolome, it's quite cost efficient. So basically, I don't want to talk too much about street prices, but I'm saying in Germany it's about full tank of gas, right? Something about lower triple-digit euros for one test, which many people could consider to do it on a quarterly level. Why is that? Because then you can look at the trending. Because on one hand, it's great to have the absolute values, but even more beneficial is to see how does a given individual behave and change over time.
Over their lifespan.
Over the lives, if you do it continuously, but even if you do it for 1 year, you get an idea of a person. For example, now in fall or winter season, you may get also some acute infections, right? And then you can also see how this affects your metabolism, but then you also see how you recover again. Or another thing is, we have now our first customers are in the longevity space. It means those are typically private physician practices offering this as a longevity service to their clients. And sometimes they also discover quite interesting patterns, and then they dive deeper, and then they actually discover quite serious diseases. But the point is, of our test, we don't tell patient A, B, C has disease X, Y, Z. That's not our mission. Our mission is to tell that something looks odd, something looks strange. So it will require a deeper dive, could be histology or could be another test, basically, to really take a deeper look.
Yes. It's wonderful that you're there. What your company does, it impacts people's lives, their lifespan. That's what Lifespin Health is all about, Ali.
Or healthspan, exactly, right? So basically, I think we won't be able to do much on the lifespan extension, but the health span, right? For example, we have conducted now hundreds of patient studies actually in different countries, and then we are seeing that so many people have metabolic syndrome and they are not aware of it. And what does metabolic syndrome mean, or what does it cause? If you eat too much, let's say, junk food, if you drink soda, then you may not realize, but you may have already metabolic syndrome, which is a quite systemic dysfunction. And the issue is you don't learn about that on an average, in an average or standard lab test, because as a standalone, the values still look acceptable. Not fine, but acceptable. And another issue is, what is normal? I don't want to be normal, because when I go to specific countries in which every adult has diabetes, I don't want to be normal. It's very important how to look at that.
Mm-hmm. What are your hopes, expectations at this conference today?
I really love this event. It's my third time in a row that I'm attending. And what I like here is the eclectic mix of leaders from different places, from Europe, from the US, from Asia. It's a great mix of people, and it's great for exploring partnering options. So we work with numerous hospital systems. We also work with different distribution companies from a go-to-market channel perspective, but also just the networking, with new investors. So tomorrow I'll be actually in a family office discussion panel to discuss the current funding landscape in Europe, for example. So I think there are many great angles how to look at this event, and I may take advantage of it in all aspects.
An eclectic mix, and you're right in that perfect place with them. Thanks very much for being with us, Ali.
Thank you very much for having me.
Awesome. Nicholas signing off from MedTech World.